So good morning, ladies and gentlemen. On behalf of the Seattle Science Foundation, it's my distinct privilege to welcome all of you to the second annual Spine Trauma course here in the beautiful Seattle Science Foundation. And fortunately, it's a rainy day, so I don't feel so very guilty about keeping you away. We are very privileged to have all of you here, and it's a phenomenal place, I think, and I hope you'll all share in the spirit of this great location and the wonderful people who work here. Rod is going to come shortly, but there's so many absolutely phenomenal people who are really inspirational here that I hope you'll have a chance to engage with them and to enjoy the day and find it very productive. I want to thank our industry sponsors. This meeting would not be possible without companies enthusiastically supporting us, and Globus, Nuvasiv, Medtronic, Stryker, DePuy Synthes immediately stepped up, and Titan, Exton, and Zimmer Biomet. I hope all of you will take the breaks to meet the exhibitors. Thank them for the support, and yes, they've brought state-of-the-art technologies here, and obviously I hope you'll have a chance to not just see them in action by our superstar faculty, but also use these devices and pick up tips and tricks of how to make our patient care better. There are three overarching goals. Now I'm coming to the real business side that I had set for the faculty, and I really hope that this will pervade the spirit of the meeting and formulate and phrase critical questions. Number one, the obvious one, how to assess and treat spine injuries. And last night's informal kind of a gathering and case discussions showed just how many open questions there are still, even the most basic things like how to assess and classify injuries, and certainly how to treat things. And we have unprecedented technological abilities to treat patients, but when and where and how to use them remains open. The second thing that is clearly emerging is the interface of not just trauma, but also an aging and more sick population, and how we treat them best. And this puts a whole new slant on it. And in fact, this may be the predominant challenge that we're facing as spine trauma surgeons. And the third thing is spinal cord injuries. Are we making progress? And are we finally getting people out of their wheelchairs and getting them up and around? And yet again, we have absolute superstars at the cutting edge of what's going on here today. And in imitating Rod Oskuin at a recent spine tumor course, he brought a patient here. I'm going to bring a former patient of mine here, a spinal cord injury patient with a bad neck injury, and you'll hear live from a patient, a very articulate man, as to what he went through in terms of his spinal cord injury. And it will not be what you're expecting. It's not a woe is me, but I hope all of us will have a chance to interact with this extremely eloquent, outspoken man in terms of what went on, what his experiences were, and what we all as practitioners, beyond learning new technologies, can take with us. Last but absolutely not least, we have an astounding and superstar faculty. I think all of you know every single one of those names. In this era of evidence-based medicine, much overused phrase, these are the people who form the evidence. Every single one of them has literally defined the literature in the areas of spine trauma that they're lecturing on, and pretty much all the other topics. And I hope you'll make use of your time today in interfacing with these great people and talking to them one-on-one, picking up their tips and tricks. We have something different from other courses. We have a 10-minute time frame where they can present a technique of their choice, and they're showing tips and tricks there. So this is a unique chance to, with high-grade audiovisual support by Jason, to really show how it's done by some true masters in the field. And I want to thank them all. And our special guest is our patient, James Osborne, who will join us later today. And he's allowed us to mention him in name. So I hope we'll have a productive day.